Here we will share with you the value of right and true information about COVID-19. You can save someone's life by sharing this video.
Data we have, it still seems to be rare that an asymptomatic person actually transmits onward to a secondary individual.
I didn't quite get that. Can I hear that one more time? I'm serious. I could not tell what you just said.
From the data we have, it still seems to be rare that an asymptomatic person actually transmits onward to a secondary individual.
The statement you just heard has absolutely harmful information. Even Dr. Maria van Kerkhove describes her statement about asymptomatic transmission of COVID-19 a mistake admitted in a professional way.
There were quite a lot of messages that I received overnight and that we received about making some clarifications to some points that I made yesterday at the press conference. So I think it's important just to if I can briefly cover perhaps some of the misunderstandings from what I said yesterday. So I think what's important related to transmission is what we know, importantly what we don't know, and what we're trying to do to really understand this very complex question. So what we do know about transmission is that we know that people who are infected with COVID-19, many develop symptoms, but there are some people who do not. And so the majority of transmission that we know about is that people who have symptoms transmit the virus to other people through infectious droplets. But there are a subset of people who don't develop symptoms. And to truly understand how many people don't have symptoms, we don't actually have that answer yet. There are some estimates that suggest that anywhere between 6% of the population and 41% of the population may be infected but not have symptoms, with a point estimate of around 16%. I don't want to get too technical, but that we do know that some people who are asymptomatic or some people who don't have symptoms can transmit the virus on. And so what we need to better understand is how many of the people in the population don't have symptoms, and separately, how many of those individuals go on to transmit to others. And so what I was referring to yesterday in the press conference were a very few studies, some 2 or 3 studies that have been published that actually try to follow asymptomatic cases, so people who are infected over time, and then look at all of their contacts and see how many additional people were infected. And that's a very small subset of studies. And so I was responding to a question at the press conference. I wasn't stating a policy of WHO or anything like that. I was just trying to articulate what we know. And in that, I used the phrase very rare. And I think that that's misunderstanding to state that asymptomatic transmission globally is very rare.
As you just heard, a top World Health Organization official clarified that scientists have not determined yet how frequently people with asymptomatic cases of COVID-19 pass the disease on to others. A day after suggesting that such spread is very rare. Quite hard to understand. People are spreading first video of the WHO official on the social media that promotes a harmful behavior. In her following statement on very next day, the said official cleared her position professionally. That's not been discussed. She did never agree with her statement. Let's use and consume information from social media wisely.